bioplasty of buds, okay, to increase the volume, to perform the contour, and this is a very good procedure to learn, okay? Thank you. This is a 23 years old female. We made a liposuction in the hips 15 years ago, and now we're going to do the bioplasty, butt bioplasty, Brazilian butt. Pode girar pouquinho, acho. Para, gira para o outro lado, para, de perfil. So you can see here some bruises. Outro lado, por favor. So the first thing to do is the marking, okay? So I draw the mark of the bikini here, okay? So we can put the mark on the right side, on the right position, like a real bikini, okay? This is the first time to do. The next step, we are going to make a line like 8 or 7 or 8 centimeters. In this case, we are going to do 8 centimeters, this line, okay? The other side, 8 centimeters. 1, 2, 8, 7. So this is the baseline. Now we are going to make another marking with this device, okay? We divide in 4 pieces, in 4 squares, like a pizza, okay? And this is square 1, 2, 3, and 4. In this case, we're gonna put 210 ml cc in each side, divide in 18 syringes in the top and 70 syringes on the bottom. Each syringe we have 3 cc's, okay? So if you multiply 18 syringes plus 3, we have 54 cc's in each squares on the bottom, and here 51 cc in each square on the bottom, okay? This is the way that I divide the volume. Another side. Ó, cosquinho. E Nath, meu inglês tá bom?
Nossa, não entendo nada.
Tô te xingando que você não tá vendo. So, we put here 4 squares in again, divide in 4 squares, square 1, 2, 3, and 4. 18 syringes on the bottom, on the top, 70 syringes on the bottom, okay? Let me confirm, okay. So the next step, we made a papule. I don't know the name, but it's an intradermic puncture with Klein solution to make the hole. The hole to introduce the cannula with anesthesia. We use Klein solution. The Klein solution is adrenaline, sodium bicarbonate, serum physiologic, and lidocaine, 2% without adrenaline, okay? So the first thing to do Just make a small hole with a little 18G, okay? You put a small hole, and through this hole we introduce the micro cannula. This is fine solution. We will put 20 cc in each square to make the anesthesia, okay? The local anesthesia. So we punch the muscle, enter like this. This resistance is the fascia, the muscular fascia. Okay, I don't know if you heard it, but there's some noise when you rub the fascia. Again, ok. Pode sentir choquinho, tá, mano? Aguenta, filho. Ok, agora foi. Não dói. É só o choque. Dói? Arde pouquinho. Ok, fecha. Anestésia. Isso aqui dói menos que a lipo, hein? Okay, we put 20 cc in the first square. Now we are gonna put another 20 cc in the bottom square. Look, it's easy to introduce the cannula. There is no resistance, okay? There's no resistance, look. There are 4 vectors, and each vector 4 cc of the anesthesia, ok? Tá doendo? Agonia, é só agonia, né? Esse aqui não dói não. É só porque você sente rasgando, né? So we're going to put the anesthesia in the second top square. Another quarter, 5 cc in each vector. There are 4 vectors of anesthesia. In the other side, I will make a draw. Okay, look, for you understand better. We have for anesthesia, we put here 1, 2, 3, 4. The last quarter we have 4 vectors, okay? We'll put 5 cc in each vector. We have a 20 cc syringe, okay? So we start this way, okay? Look, we have to rub the fascia. So we put 5 ml here, 5 ml here, 5 ml here, and 5 ml there, okay? So the decision is okay. So we have to wait about 10 minutes before start the application of the product, okay? See you soon. Hi fellows, there's another marking that I want to show to you. The marking of the vectors of the application. So we have here a cross, you can see a cross, okay? So there are 18 syringes in this quarter, okay? So we divide in three applications of 6 syringes, okay? So this is 1 vector, 2, 3, 4, 5, 6. Okay, this is the direction that I will introduce the cannula to distribute the product. Okay, so 3 sets. There are 18 syringes. Okay, 1, 2, 3, 4, 5, 6. So here we will put 3, 2. 1, 2, 3, 3, 3, 3, 3, 3, 3, 6, 9, 12, okay? 3 in each cross. So there are 3 syringes, 6 per 3, there are 18, okay? This is a pistol, an application pistol made of iron. a surgical iron, okay? This is the cannula. We have a cannula here, 8 centimeters or 80 millimeters plus with 1.2 millimeters of diameter, okay? So this is the micro cannula, who we did buds. This is a larger micro cannula than the facial micro cannulas, okay? So respecting the marking, okay, we introduce the cannula. So the angulation of the cannula is like 45 degrees, okay? Introduce and start to application. Um choquinho, tá? Now you have to change the surgery. I have an assistant. So we change position in this direction here and start your application. This is, look, the micro cannula is entire into the muscle, okay? The most deep position you have to put it. Here. Tá doendo, ó. Você tá com medo? Então você bem tranquilo, porque se você ficar reagindo muito, eu acho que tá te machucando. Eu não quero que você sofra, tá? This is the 4th syringe. The 5th one. Doeu? Relaxa. Tem muita agulha aqui. So the 6th syringe. Here in this position, we repeat the syringe because this cross is the structure of the tent, for example, okay? So we put more syringes on the cross than in other sides, okay? So we repeat the syringe here. So in this point, we have 2. So we start again. So 3 passes, 6 syringes, more 6 syringes, more 6 syringes, 80 syringes, 18 syringes, okay? Vai ficar isso. 11. Tudo bem, né? Tá sentindo dor? Relaxa. Deixa, não contrai não, relaxa. So you can see the volume starting, okay? Essa é a 13. Tem algum ponto aqui que não tá legal. Contrai não, tá? Tenta relaxar. 14. 15. 16. 17. 18. Okay. Now we finished the first quarter, okay? Let's mark in another quarter. 1 here, 2, 3, 4, 5, 6. As we start again in the cross, on the cross, every application in the cross is more, there are more quantity of product than the other vectors, okay? Because we have to repeat here and here in every quarter. We repeat on the cross in every quarter. So we have double product on the cross comparing to the other vectors, okay? So this is this the structure of this kind of procedure, okay?
Yes.